I think when you're picking a program, you really have to choose what you want.
So it's more about applying what you've learned in dental school and being a real grown-up.
You're going to learn the surgical skills, but how do you implement that? How do you integrate that with your relationship with the community that you're living in?
I'm Joseph Zalik.
My name is Nagar.
And
I'm a PG Year 3 in the orthodontic department.
I'm an oral maxillofacial surgery resident.
I'm in endodontics.
Prosthodontics.
Periodontics.
I'm a second year pediatric dental resident at NYU.
I love being in New York. I love the diversity of our patient population and how vast it is.
NYU as well, it's New York in microsome. You put all of New York in one building.
With New York comes an amazing patient population.
The amount of patients that we see in terms of numbers or complexities are beyond what I could imagine.
So when I do practice somewhere else, I feel like I prepared for it, pretty much anything.
The main reason why I chose NYU was the clinical experience.
I feel really lucky to have had already so much contact with all these challenging cases.
You're learning hands-on and in the classroom, which is what I was looking for.
We teach them and hope they grow and become a better clinician, healthcare provider, or for that matter, a better citizen.
The faculty are not only great clinicians, but they're great people.
I like to build a kind of environment that is really nurturing.
The education of the students is really at the forefront of our mind.
You really learn one-on-one from their experiences.
This is a place where there's a lot of opportunity. We work hand in hand with all of the other specialties.
You have access to specialists as well as graduate students from all the disciplines in dentistry in one building.
Collaboration is easy. If you need a consult, it's just a couple steps away.
If I can say it in one word, it's teamwork.
I feel like I've learned a lot in my 2 years here.
I'm able to handle very complicated treatments.
The principal factor that they teach us is like to bring quality of care to our patients.
I always felt at home.
I felt like this is just where I belong.
It's definitely the place to be.
NYU is a whole different ballgame.